Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers podcast. I'm excited to be sitting here this wonderful, very rainy morning with Dr. Christine Meyer. Dr. Meyer, I think, is the most important voice on LinkedIn around this entire Change Healthcare, United Health debacle. That's really causing a lot of suffering and a lot of conversation, let's say, around independent doctors. And so, Dr. Meyer, thank you so much for joining us today.
Thank you so much for having me.
It's a pleasure. So, if we could just dive right into this story, you're in, if you can give us a brief intro to you. I know that you're an internist and you've got a bunch of docs working under you for over 20 years. You've built this incredible practice that's booming, independently owned, which is so difficult to do these days. Everyone's either trying to buy you or destroy you, it feels like, right?
Exactly.
And just put us in your shoes for a moment. And how did this whole thing break?
Yeah. So, like you said, I have a huge practice now, 23 clinicians, 100 employees, independent. We do all our own stuff. We do all our own, in-house billing. My mom was my original biller. She's almost 80 years old, still there. And I'm embarrassed to say, until the afternoon of February 21st, if you had said to me, what is Change Healthcare? I'd be like, I have no idea. I didn't know that was a noun. I just felt like it was something we were supposed to be doing, right? So it literally wasn't until like all hell broke loose that I even learned what that was. And it was because my billing manager, my now current billing manager, came into me and said, hey, I need you to know that Change Healthcare is down. And, we have a lot of have a lot of tech in the office between our EMR and billing and scheduling and all this. So, and something's always going down. And I'm like, okay, it'll come back up. Like, that's what happens. Like, did you unplug it and plug it back in? Exactly. And she was like, no, you don't understand. This could potentially be very bad because we can't submit any claims. And that's how I first learned that there was, some potentially catastrophic thing happening. But honestly, it wasn't until several days later that the true magnitude really started to set in for us.
And what was that? What was that realization?
Well, first of all, things tend to go down and come back up immediately, right? And so now we're going on day 2, 3, 4. And I think the biggest clue for us that this was going to be terrible was the lack of communication from anyone at Change Healthcare, United Health Group, Optum Financial, like the whole, litany of billions of things that they own. They had this website for updates, and my spidey sense got icky when I noticed that every single day their updates were basically copied and pasted from the day before. Change Healthcare is down. We expect the outage to remain throughout the rest of the day today, every single day for like 5 days in a row. So we're like, this can't be good. And nobody had any information. Our software vendor couldn't tell us anything. You could not get anybody on the phone. Meanwhile, my billing team basically sitting ducks. We're doing the work. We're seeing the patients. Our process is moving forward. But, my billing team of 5 full-time people is just sitting there like twiddling their thumbs, like, we don't know what to do. We're just going to sit here and wait for it to come back up. So it was this, terrible limbo with zero communication or understanding about what was happening, why, or what we could expect until, the media started sharing some information about a ransomware attack and all that.
So you had no idea that it was a ransomware attack until the media broke that?
Pretty much. Yeah.
About it. So, and they didn't even say that their system was down. Your biller just was, this system is not working.
Right. Like literally, I'm so embarrassed to say I have no idea how the sausage is made in my practice.
Yeah, a lot of internal people.
Yeah, but she, apparently there's something there, when we bill, we hit a button to upload billing files and it just goes and magic happens and money flows. And on that particular day, they got like a big red box, like, this isn't going to work, basically.
Right.
Yeah.
Right.
Yeah.
Okay, so now let's fast forward to today, and then we'll cover the in between. So today is April 12th. This started at the end of February. What has changed? What's the status today?
It it's still terrible. So Change Healthcare, okay, there's so many moving pieces here. United Health Group Change Healthcare is a big piece of the problem. Another huge problem, at least for us, has been our software vendor, right? Because most practices aren't engaging with Change Healthcare directly. We have like this middleman, if you will. And we've
Yeah.
been with the same software company for 2 decades. Never
And
had
by
a problem.
software, do you mean the EHR, your practice management system,
Practice
general
management
IT?
system.
Okay.
Yeah. Our EHRs is separate, but our practice management, so scheduling, billing, reporting, all that stuff.
Yeah.
And they've been great at small local company. And we were a small local company. So we're like, we're going to support our own. And that's what we went with. And it's been great. But little did I know that they had not upgraded any of their platforms at all for 20 years. And so they were operating Change Healthcare on this super antiquated platform. So when Change Healthcare went down, and then there was talk about it's going to come back up and blah, 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 our software vendor had no backup plan, nothing. They didn't have an alternate clearinghouse. They didn't have a crisis management, like nothing. So we were basically at their mercy. Like, what do we do? And they had nothing for us. So we spent tons of time just creating workarounds to submit claims.
Okay.
Clunky, manual, inefficient, just a bunch of junk to get claims out the door. All the while waiting for Change Healthcare to come back up. So today, United Healthcare, well, I should say last week, United Healthcare was all about Change Healthcare is coming back up. And then there's a second attack in the middle of them coming back up. And the implications of that, like, God only knows. But in the interim, our software vendor decided they were completely abandoning Change Healthcare and going with an alternate clearinghouse. And
Okay.
this is like Swahili to me. I feel like I've learned a million years worth of lingo in the last couple of months. But basically what that means is we have to start from scratch. We have to reconnect with all of our payers and say, when you get bills from us, they're not going to be coming through the Change Healthcare conduit anymore. They're going to come through this other clearinghouse. And that's a process that takes a long time.
And who
So
has to pick up that slack? You have to do that, or the
we,
or the vendor has to do that?
Well, we're doing it. I mean, the vendor provides us the ability to use this alternate clearinghouse, but we
Yeah.
have to pay for it. We have to submit all of these things called enrollments. We have to rework our entire process. There's a huge learning curve with that. So even though the ransomware attack, the initial one on Change Healthcare, has kind of fallen out of the news, Change Healthcare is still not back up fully, number one. Number two, lots of people are in my position where even if it was back up, we wouldn't be able to use it because our software vendor bailed on them like immediately for right or wrong. Like, that's what has happened. So now we're dealing with a completely new system, still not submitting bills efficiently, still not getting paid. By my calculations, I think we are negative about $300,000 as of this moment from where we should be at this point in the year. So it's huge.
And it's not like payroll goes away or utilities go
Oh
away, and
no,
you know.
exactly. So, and I didn't mention this, but when I started my practice, my husband was simultaneously starting a pediatric practice. We actually share one of our buildings, and he has a smaller practice, but they also use Change Healthcare. So for our household, we've had zero income for several months because we have to pay our staff, we have to pay our expenses, like you said. So yeah, it's been tough until, and I'm sure you're going to get to this. Optum came up with this financial assistance plan.
What does that what does that look like?
So when it first came out, and I don't know if you heard about this, but it was the biggest joke in the
It's four
world. It
thousand
was
dollars,
actually,
right?
yeah, it was like insulting, right? So here we are. we're not able to submit like, I don't know, $500,000 worth of claims every month, and you're offering me 4,000. Like, I can tell you what to do with that $4,000. But I guess the word got out to them that was like, they would have been better off offering zero than this ridiculous amount. And so they changed their approach, and they actually started talking to us about, what did you expect and what are you actually seeing, and we'll make you whole with this interest-free loan.
Mm-hmm.
So that's what they've been doing. And to be fair, that's been a godsend. That money is what's held us up. Like, we would have definitely been tapping into personal resources, personal lines of credit, all of that. So between the better Optum loan and the fact that our ACO, my ACO, Aledade, which is a national ACO, they fronted us a huge amount of cash, like immediately, like an overnight wire transfer into my bank account. Like, that was, I could cry even talking about it. It was like, they saw our need and they were like, boom, here's the money. Like, I'm sorry, if Aledade can do that, United Health Group definitely could have done that, but between those two things, like, we're okay, but this is all, it's almost like fake money,
It's not the right money or the real money.
Exactly. It's going to get paid back. Right. Exactly. We got to figure out, like, where do we really stand without this, money that's just basically propped us up temporarily.
Yeah. Okay, so now that you've been in this, and what you're describing as far as not knowing how the sausage is made is, I think, probably 99% of doctors and practice owners around the country, independent. So now that you've been in it for a couple months, do you have better clarity about what a clearinghouse is and how that works, and because I know you've been doing a lot of talking to a lot of different people. So maybe now we can take a step back and you can explain to maybe a doctor, because I have clients that are suffering. I chatted with you offline about this. I have clients that are suffering greatly still from this. And I think that, you seem to be in a position where at least you're able to be vocal and talk to people. There's a lot of docs that are just underground, and they don't even know to pop their heads up above ground and talk to people, and they're still completely in the dark. So if talking to the independent doctor that is suffering but has no idea what's going on, what is Change Healthcare? What is a clearinghouse? Why did that affect them? If we can start there, I think it'd be helpful.
Yes. So the way the process works is we see a patient, we do whatever we do to them, give them a vaccine, do an EKG, whatever we do in our office. We generate a billing sheet or a billing statement based on that visit. Here are all the things we did, and here's the charges for them. That information goes to our billing team, and they enter it into our software program. It's called Practice Manager, which then collates all of the day's charges. 23 clinicians were open 12 hours a day, 7 days a week, like thousands upon thousands of claims. The software program puts that all together into a nice file, a beautiful file. By the way, it's called an 837 file, in case you're curious. Had no idea what that was. And then that file, through literally one click of a button, is uploaded to Change Healthcare. And then Change Healthcare spits these claims out to the appropriate payer. Like, okay, this claim goes to IBC, this claim goes to Medicare, this claim goes. So all we have to do is generate this file. We were not submitting claims directly to each payer, which was so efficient. And then the back end of that is Change Healthcare would then return to us something called an 835 file, which is, here's your claims that you submitted, here's what was paid, here's what was rejected, and here's why. And then our team could kind of like dig into that, like all of the rejections and all that stuff. So the clearinghouse, just super, efficient way to submit thousands upon thousands of claims to, potentially hundreds of payers, all in an instant. And that went away.
Right. And so they get shut down. Now, how many such clearinghouses are there? Are there only a handful, or is it a dime a dozen?
I think I wouldn't say a handful, but I wouldn't say a dime a dozen. I think there's many, but unfortunately, Change Healthcare was the best one. The most efficient, the easiest to use, the least expensive, the most prolific. which is, a double-edged sword. So they go down, and with it, all these practices.
Such a tough spot to be in, because the answer is not making your software bad. The answer is making your software really really good. But on the flip side, it's kind of I guess it's kind of a black swan event to get ransomed. It's not something that anyone really plans for. Maybe people
Right.
should, and maybe should more often.
Right.
And so, speaking about the ransom, because I remember about a month ago, an article came out that or maybe it was right after, it was within a couple of weeks, that everyone was furious that they supposedly paid, like, I think it was $20 million
$20 million. Yeah.
to the hackers.
Yeah.
Was that accurate? Did that actually happen?
I don't know. I don't know. I don't think there's ever been any clarity on that. But I will say this: one of the things that nobody, or not enough people, are talking about are the 6 terabytes of protected health information that got taken, right? So listen, I have to operate my business. I need money to do that. But holy crap, that is a lot of personal data that these, hackers had
Yeah.
a hold of. And so, as much as I have disdain for United Health Group and the way they handled this whole thing, like, if they could potentially rescue some of that protected health information by paying a ransom, I don't know that that was absolutely the wrong thing to do. Unfortunately for them, it turns out, if they really did make this payment, it turns out the ransom, where attackers walked away with the data anyway. So they never released their data. So they paid the money and they still killed the hostage. So
Right.
I don't
Right.
know.
Remember when? Remember. I don't know. When I was a kid, there was this. Concept called never negotiate with terrorists. I don't know when
Yeah,
that
yeah.
got canceled,
Yeah.
but it's no
Yeah.
longer an operating
No, we're negotiating every single day. Right.
yeah, on
Right.
all fronts, both literal and
Hmm.
from a data perspective. And so, it's. Do you know anybody at any of these companies? Have you managed to? I mean, you've made a lot of noise, and rightfully so, about the topic.
Yeah.
Have you ever did that get you any kind of positive communication with anyone at Optum and or Change Healthcare?
Yeah. So, not at Change Healthcare. Um, I actually, it's so funny because I desperately want to hate everybody at United Health Group and Optum. I really do. I want to blame everything and person associated with them. But this has helped me remember that within these gigantic organizations, there are some really, really good people trying to do their jobs
Yeah.
and really genuinely trying to help. So I got a call from the chief financial officer at Optum Financial, Corey Grunberg, and then he connected me with basically some of their lead software technicians who were really just trying to help us figure out workarounds while this whole thing was happening.
Hmm.
Um, and what has come of that is, I now have a person, if I am struggling because my loan payment didn't come in or something like that, I have a person that will immediately make it happen.
Right.
Do I feel good about that? I don't know. It's just me. I'm one practice. Like, clearly they can't do that for everybody, but the squeaky wheel, gets the grease, right? So that has happened. I also learned a lot from these conversations with really high up people in the Optum organization. And one of the things I learned is that a lot of this falls on the local middle software vendor,
Hmm.
because the Optum team has been, from my, what I've observed, and I'm not techie at all, have been desperately trying to work with our software vendor to create a simpler workaround. And it seems like our software vendor was either unable or unwilling to continue to work with them. And, I don't know if this is like a middle school, like mean girls situation where they're just like, no, we're not working with you under any circumstance, or if they have legitimate reasons for just like breaking all ties. But from my perspective, when I'm talking to the people at Optum, and they're like, we can help you, we can help you. All we need is your software vendor to do this one little thing. And then I've got my other phone. I'm like, hey, software vendor, do this one little thing. And they're like, no, we're not going to do that. And I'm in the middle. I'm like, ah. um, it just feels bad.
Yeah.
So who do you believe? It's
Yeah.
hard to say. But I
Yeah.
will say there are some people who genuinely would have, could have, done everything to try to help us within that organization. Is it the Andrew Whitties and the super high ups? No, but it's people who are like showing up to work every day trying to do their best.
Yeah, yeah, and I'd have to imagine they put together a task force and are having, there's definitely people at the organizations. I'd have to imagine that are waking up every single day and spending 12 hours a day trying to, banging
Yeah.
their head against the wall trying to figure this out. And now, if I recall correctly, you did a post also kind of calling out the software vendor, talking about how critical this piece was and being terribly handled. Has that improved? It sounds like you're still working with them. So is this
No,
are
so
you a hostage to the
we are. This is so bad. I mean, first of all, this is like a marriage, okay? I feel like we have had this amazing marriage, and all of a sudden, this catastrophic affair happens, and now we're getting a divorce. And it's like, I did not see it coming. Like, that's what it feels like, because they have been great, but we were never, and maybe shame on us, we were never like checking up. We were never saying, hey, is your platform updated? Hey, do you have another plan? Like, none of that. We were just like assuming they knew what they were doing.
yeah,
And so that was our first thing. The second thing is their communication rollout was atrocious. They said nothing for a couple of weeks. And then when they did say things, it was very vague. And then they indicated to us that they were going to actually wait for Change Healthcare to come back up. So we were like, yay, we're going to wait too. And then they decided, no, we're not going to wait for Change Healthcare. We're going to go to this alternate clearinghouse. And that's going to take all this work. And we can't necessarily support you in the way you need us to support you. So a lot of my personal frustration has definitely been at the hands of our software vendor, for sure.
now you
But,
said
we can't change now in the middle of all this.
right, and you're so deeply integrated with a partner like that, you can't just
Yeah.
switch on and off. So the smaller company, though, the smaller software vendor, if they're a smaller company, I mean, how many people are at that organization and how many clients do they have? What I'm trying to get at is, did you not have a very, very senior executive person at? I mean, for a smaller company, you're a very big practice, I'd have to imagine.
Right. Well,
Did you not have a
exactly.
senior executive on the phone with you saying, "Hey, Christine, here's what we're doing here"?
No, I mean, and here's the thing, and this is part of our problem too. Again, shame on me. We've learned through this that we are their biggest client, and we probably outgrew them a long, long time ago.
Uh,
And it's been sort of like this, house of cards thing where it's been working, but like just by a hair. Like it just took one catastrophic event for that whole
thing to
thing to crash down. Yeah.
I don't think it's your responsibility to know whether your software vendors have updates pending. I don't
I
agree with that.
mean,
I mean, that doesn't make
I
any
don't know
sense.
how many things we're supposed to know. It's hard enough to know all the crap I have to know every day,
No, it's just not. That's not feasible. It's not sustainable. It's not feasible. It doesn't make any sense. Like now, in retrospect, you're aware that there was an update, but there's no way for you to proactively know about all the various software updates that your vendors have. That's a vendor's
No,
responsibility to come in to know that they have the best product and the best solution out there.
exactly.
I mean, look, the overarching massive lesson to be learned here is communication, right? I mean, the only
Absolutely.
thing the only thing you can do worse than your service shutting down is not communicating about it, right? At the end of the day, if they would have picked up the phone on day one and said, "Hey, here's what's going on. We're all in trouble. We're in big trouble, but here's our perspective. Here's the various avenues that we're going to look at here," like I would imagine you would be a lot less upset, right?
Absolutely. And honestly, I feel like our relationship deserved that. You
Yeah.
know, every client deserves that, white glove service. But seriously, we started with you when we had zero patients and $0 and have and by the way, we spend a ton of money on this software vendor because they also manage all of our hardware support. So it's hundreds of thousands of dollars.
Yeah.
It's not small, and to just not get that was super frustrating and eye-opening. And I still don't know what we're going to do because,
Yeah.
there's never really a good time to completely cut those ties and start over. Certainly it's not now. So it's
I'm
going to be a really
surprised.
tough thing.
I'm surprised that there aren't younger, hungrier vendors that are willing to make it a seamless process for you to switch over. I'm
Well, there probably are. um, so just on LinkedIn alone, I probably get, 10 messages a day from people who can fix my problem,
right.
you know, but I don't know if I have the mental brain power right now to vet all those out and consider how that, like, the evil I know is a
Right.
little bit safer for me right now. But when we're back to normal, when the Change Healthcare dollars are paid back and when our cash is flowing normally, it's definitely high on my priority
Priority.
list.
Now,
Yeah.
now that they've decided to switch away from Change Healthcare entirely, is that going to affect your ability to get assistance from Optum?
No, it doesn't seem so. So, and that's another, kudos to Change Healthcare. Optum, they basically had said, we're going to support you until Change Healthcare is back up.
Hmm.
Now their language is changing a little bit, and it's more like until your operations are back up. So
Hmm.
I hope that means that regardless of what,
Right.
clearinghouse we're using,
Right.
the support will continue.
So, do you now have essentially a backlog of 2.5 months of claims that need to be submitted?
God. So we've been submitting,
Okay.
thanks to my rock star team. And we've literally, like, we have all these scribes, these 20 something year old pre-med students or going on to med school kids. We recruited all of them, like 10 of them. And they have been like clicking away manual data entry, all of these claims. And so claims have gone out the door. Our problem now is what's coming back. So, how do we assign these payments to the right patient accounts? How do we reconcile our accounts receivable? These are all almost bigger problems. And that, my billing manager, Sue, told me yesterday, she's like, we're not going to be good until July. She's like, don't even expect me to be able to give you a single report that's accurate until July. From February to July, like 5 months? That's insane. It's insane, but that's where we are.
How is it not up yet? I mean, it's been months. How does that happen?
Well, they did
Now the
apparently
entire
phase things and test things, and again, if you're on a old platform, you're lowest on the totem pole.
yeah.
I don't know.
Yeah.
It's unimaginable.
Yeah. And I mean, look, going back to kind of the people versus the system, like I know people at Optum, I know people at Change Healthcare even, and they're all incredible people on an individual level. And, the question is, where does this break? Like, what's at fault? And I'm sure each individual person, or I should say most individual people, would love nothing more than to get you up and running within 4 minutes.
Yeah, yeah.
And the question is this, Change Healthcare obviously was acquired, whenever it was, and they're owned by larger systems, and those systems are owned by larger systems, and all the way up to United Healthcare. Is this just another story of a once agile company that gets bogged down by red tape of massive corporation? Is this policy that's interfering? Like, I'm so curious from their side what the story is.
So, I was thinking a lot about this. I was thinking, who am I really angry at? Like, where should I be assigning this blame? Um, and when it comes down to it, they had a security breach. Their system was breached, right? And no matter I'm not a cybersecurity expert either, by the way, in case you didn't notice, but it seems to me like from my office operations that are super simple by comparison, breaches like that tend to happen, someone used this analogy so perfectly, between the chair and the keyboard. So there's like a person
Mm,
that's sitting there that, you know didn't shut down properly, didn't reset a password, didn't pay attention to the phishing email, or whatever the thing is. So there is some component of a human error that had to happen here. And how do we blame that poor sap? Like, I've definitely walked away from my computer and left it not secured. Like, we all do that. I think the bigger issue is, why did it take a company like United Health Group so long to figure it out, shut it down, and fix it. Like that to me is the biggest question in the world.
Yeah. Yeah. And it really, I mean, it's just again, it really comes down to communication. That's that. It's so loud and clear what you're saying. It's like, just communicate with me, and that is
Yeah.
not hard because people are so afraid. And look, people don't communicate for one of two reasons, right? Either they're incompetent, or the company's so big and they don't care to communicate because whatever, or they're scared that if they
There's
communicate, then people are going to know that how bad it actually is, right?
exactly.
And I think that
Exactly.
B is a huge mistake. I think that every
Totally.
single person wants to be communicated with and tell me exactly what I'm facing. Tell me what my
Yeah.
worst case scenario is. You know what I mean?
Mm-hmm.
Tell me that every
Mm-hmm.
single one of my patients' social security is now belongs to the Russians. You know,
Right.
whatever it
Right.
is, tell me, and just communicate. You know?
Yeah. Let me react to it and not just sit here not knowing. Yeah.
Yeah. Wow. Okay. So once again, it's April 12th. Uh, what are some practical things? Because like I said, I literally have clients, and there's one thing that you suggested, which might be the answer, but I have clients that are still suffering tremendously. What's one thing that a small practice, we're talking one doc, the wife is the practice manager, they've got
Oh.
maybe a couple, what can they do? And they're not getting any revenue in. What can they do to maybe start crawling out of this pit? In your opinion?
Yeah, so I think there's two things. The first thing is if they don't have an Optum Pay account, they need to set one up. Just, it doesn't matter like if you have a ton of United Healthcare patients or not, you need to set up an Optum Pay account. And once you have that, you're eligible for funds. If you've been using Change Healthcare, you're eligible for funds. And I would just start that process. It's actually simpler than you think. And
Okay.
it's basically an interest-free loan, and there's no timeline. Like they were not like you're paying this back by June. Like there's still no timeline. So definitely do that. And then I would say, you can submit claims in less efficient ways, but you can get them out the door. So Medicare, for example, you can submit claims on paper. It sucks, but you can do it. Lots of the insurance companies have payment portals,
Right.
like Independence Blue Cross has a payment portal, Aetna has a payment portal. You could just send your claims through there. Um, it's not as fast, but money will eventually start to come in.
Yeah.
And then hopefully along the way, they're reevaluating, the Change Healthcare situation. Are they going to go back to that? Are they looking at other clearinghouses? Because if they're doing that, they need to start immediately because that is not a fast process.
Yeah. So, okay. So you're basically saying cut the clearinghouse out of the process, go manual to each individual payer, whatever the individual payer's, method of submitting is, whether it's paper or a portal, do that.
Yep.
And
Yep.
will reports come back for each individual payer to be able to reconcile, what they paid, what they didn't pay, what the patient's responsibility was, things like that?
Eventually, it's just going to be slow and it's going to be a pain in the neck. We just got a 400-page remittance report
Oh my goodness.
because at one point my team was so nervous they submitted the same batch of claims like 3 times.
Right.
So like 2 out of the 3 were rejected, and that's all in this giant report.
Right.
So it's going to take a lot of time, a lot of cleanup, but at least the money will be flowing. Like put the fire out in front of you, and the fire in front of you is I don't have any money, right?
Yeah.
So get the money and then deal with the backlog later.
Yeah. Yeah. Incredible. Wow. Okay. Well, let's hopefully this entire Change Healthcare debacle does continue to improve. I once again, I think that your voice was extremely important, and continues to be important on the subject.
Thank you.
And so it seems like, and kind of moving out a little bit, it seems like you're just for a couple minutes. It seems like you're obviously very passionate about patient care. I know that you're a big proponent of value-based care, which is the central theme of the podcast here. So, as an internist, talk to me about value-based care. How have you implemented? What's your view on value-based care? How have you implemented value-based care, risk-taking contracts versus fee for service, and as an independent doc? Super curious.
Yeah. So I think honestly, there's a really good segue here, Mendel. So one of the things that's been tremendously helpful for us in this whole Change Healthcare debacle is our guaranteed payments. So our capitated payments, our quarterly primary care first payments, our ACO payments. So those come whether you're billing or not.
Yeah.
So like, thank God for value-based care, because that's been like sure money in the bank. And that's a very, oversimplified way to say it, but it's been really helpful. I think value-based care is the way of the future. I think that we should be paid for how well we care for patients, not how much stuff we do to them.
Yep.
And it's hard work, but one of the key tenets, I think, to successful value-based care in any size practice is to get in the contracts and then immediately say to yourself, I'm going to reinvest some of these value-based care incentive dollars, because there's low-hanging fruit. There's dollars to be made almost immediately, no matter how good you are. Take that money, reinvest it into your team and your systems, and grow a process where you take care of patients just by their chronic conditions, keeping them out of the ER, improving your access, improving the patient experience. I think where a lot of practices maybe fall short in value-based care is they get those early dollars and they spend them. I'm not saying they buy a villa in Tuscany, but they plug holes, right? And then they don't think about what's coming next, because value-based care gets harder and harder the better you get at it.
Yeah.
So you just have to be building that team, and even more than the team, building the culture within the practice. Like, this is how we operate. This is from front desk to phone to clinician to MA. Everybody's got to be bought in. And it's a process, but I think if we're good at value-based care, we're going to save primary care, and we're going to save healthcare dollars, and the patient experience is going to improve. So it's definitely a conversation that has to continue. And I'm so grateful for you and podcasts like yours that actually call that out, because a lot of people don't know. They don't even know that value-based care is a thing. They just go to the doctor and, pay their copay and go about their business.
Right. What I think is maybe even more interesting to me is the doctor at your level. I think a lot of doctors at your level don't know. And so most people think of value-based care as contracts that are to be negotiated at some sort of health system level, some massive patient panel level, right? And it's not the place for a super large independent practice, but you're not a health system, right? And it's not your place to go negotiating those contracts. And so how did you go about that? How did you go about getting those capitated, reimbursement plans, and what does that look like?
Yeah. So first, I was terrible at it at first. Our first value-based care contract that was introduced to me, this is literally what they said. They said, we're going to pay you an additional, I forget what it was, $20 per member per month just to participate in our program. You don't have to do anything well, just be in our program. I'm like, why would I say no to that? Yeah. So I signed on the dotted line. And then the first 2 years, they start offering us these incentives for quality measures, like, did your patients get colonoscopies? Did they get mammograms? And we were terrible. We were so bad. We earned $0 for like the first 3 years. And I was so disgusted by that, because in my mind, I'm like, I'm a really good doctor. I have a really good practice. I should be doing a really good job. Like that, it should just flow like that. But that's not how value-based care works. You have to be so proactive. You have to go after these deficiencies that patients have to get good at it. So once I figured that out, and then the incentive dollars started to come in, I was like, whoa, this is good. And now we know how to do it. And, we built this practice where the processes we follow for our patients are payer agnostic. Whether you're in a value-based care contract or not, we're providing the same level of care, the same standard, the same workflow. And so our whole population of patients has just gotten better and better and better in terms of their outcomes, because of that very first contract that we really sucked at. That's awesome. And then all of a sudden you start to get like invitations from, all kinds of payers, like be in our program, be in our ACO. So I think it has to start with this idea that take what's offered to you and then reinvest some dollars, accept the failures, get good, and then it just happens from there.
That's a great lesson. That's a fantastic lesson, and I don't think we can top that. So, Dr. Meyer, this has been really illuminating. I hope that a lot of people listen to this that are suffering from the Change Healthcare, outage right now, and that I think this will help a lot of people. Please continue to be extremely vocal on LinkedIn. Don't quiet down after this gets fixed, because I'm sure it will at some point. Because
Yeah.
you're an important voice, and it should really stay that way.
It is such a pleasure. Thank you so much for having me. And I'm happy to connect with any doctors or practices that are struggling. Feel free to share my contact information. If I can help in any way, I certainly will.
That's super nice. We'll do. Thanks a lot.
Awesome. Thank you so much for having me.